So today I'd like to go through a facelift case, but I want to go through it starting with a photograph that a patient sent to me shortly after her surgery. So most of the time we're looking at facelift results, and I think that it's valid, is to look at very defined before and after pictures. So classic teaching is that you need certain views of the face before and after. So you have one from the front, we have an oblique, and then we have a true lateral view of the face. And what's nice is to have a picture taken by the same person using the same camera with the same lighting so that really you're just looking at the result. So most of the time when we look at facelift results, we're trying to get the most standardized before and after pictures. But what is interesting now is the pictures that I get from patients are, I think, more impactful than the traditional before and after pictures. So I want to go through a case that was some pictures that were sent by somebody shortly after their facelift. So let's go through this. So this is a very pleasant 53-year-old woman, and her significant past medical history is that she had massive weight loss. She had bariatric surgery at one point in her life. She went on a GLP-1 agonist, and she successfully lost weight. So if you look at this picture, and we'll start by showing the selfie that she took. This is before her surgery. And if we just look at that, so this is somebody that has a combination of traditional aging. So this is a woman who's 53. She's not 25. And you can see changes related to that. You can also see changes that are specific to weight loss. There's a lot of talk these days about Ozempic face and what these GLP-1 agonists are doing to the face. And it's a generalized atrophy. And whether there is just weight loss related things going on or if there's something specific to these medications, but we're clearly seeing a deflation with these medications. So when you look at her before picture, you can see that she has a very indistinct jawline. She has heavy jowls. She has a lot of loose neck skin. There's been some deflation in the cheeks. She has some redundancy in the upper eyelid. And she also has a little bit of ptosis or lengthening of the lip, which is pretty typical as we go through life. So when you look at her pictures, she has changes in her face that are related to aging, as well as weight loss and specifically GLP-1 agonist related weight loss. So the things that really concern her are the upper eyelids, the lack of volume in the cheek, the indistinct jawline, the heavy jowls, and then most specifically, the neck. And then she would like some subtle changes to the upper lip as well. So the reason that I like this picture is because in one picture, you can see a massive amount of change and you can see how she perceives herself after the surgery. So if we just start, from the top, so you can see the redundant upper eyelid skin. You can more specifically on the left eye in the picture. And then in the after picture, even with her wearing glasses, you can see a nice crisp upper eyelid fold. The upper lids have been completely rejuvenated and she looks rested. So just from that simple upper blepharoplasty alone, we can see an enormous amount of rejuvenation. If we move down the face, so we'll start with the area under the lower lid. So she did not need to have her lower lids done. I think that she had a reasonable lower lid cheek association, but by doing a facelift and bringing up that mid face with the facelift, you can see that the lower lid and the cheek have been restored. So we have improvement in the upper lid with upper blepharoplasty. We have improvement in the lower lid and the cheek with the result of the mid-facial rejuvenation from the facelift. As we look down the face, so if you look at her before picture, you can see a very indistinct jawline. She has a little bit of depression in front of the ear. There is a bit of a hollow, a concavity right here at the angle of the jaw. And then there's all this hanging tissue that we call a jowl. And if you look at her after picture, the one that she sent shortly after the surgery, you can see that the jawline is smooth. The jowl has been eliminated. And that is the result of the tightening from the facelift and face and neck lift. As we move down, so even from the angle that she's showing her face and neck, you can see all the redundant skin in the pre-op picture. You can see the heavy jowl. You can see the the excessive subcutaneous fat and excess skin in the neck. And that's all been corrected with the face and neck lift. You can't see in this picture the extent of the upper lip rejuvenation, but she also had a lip lift. So if you look in the top picture, you can see the lip looks quite reasonable in this picture, but you can see that in the lower picture after the surgery, you can see a more youthful lower upper lip. The upper lip, the distance from the nose to the lip has been shortened. There's been some eversion of the vermilion, the pink part of the lip, giving the appearance of a fuller, more youthful lip.